Jenny Simpson. I'm the digital product manager here at VETalk, and today we're going to talk about pain in your pets. September is Animal Pain Awareness Month, so today I have Dr. Brian here with us to discuss pain and mobility, so anything from aging pets to your dogs or cats having a hard time getting up in the morning or going down the stairs. So post any of the questions that you have below, and we'll do our best to answer them during our live stream here. So Brian.
Hello everyone, it's me again. I'm happy to be here to talk about pain in your pets. It's never a fun thing to see that, and it's always a difficult situation to really determine what is the cause of that pain, and that's why our veterinarians are there to do that. But certainly today we can discuss some of those things, or maybe some things that you can do, or even to help them maybe even before you get to the veterinarian for pain.
All right, great. So we'll kick it off just with our first question. Thank you to Barbara for sending this in. She has a question about her 10-year-old male Chihuahua named Buster. He sounds very cute. He has a right rear luxating patella and limps and sometimes drags his body without using his legs. He's been on supplements for a couple years, and she doesn't think it's working anymore. So what would you kind of suggest for helping her out? You know, how do you know if the dog is still in pain?
Yeah. I mean, just not using first off, not using the right rear leg and kind of dragging the leg and the right side of the body would make me think that it's maybe more than the patella. Again, I cannot examine Buster here. I'm not there to examine Buster, so there are some things that can be done by your veterinarian to determine if there is some back pain associated with that, or some back issues. Similar to humans, dogs can get disc issues as they age. There's certain breeds, such as Dachshunds, that can also have those issues or disc problems. So to me, that would be probably the first thing that I would do with that. Some of the joint supplements that are out there to help with the patellar luxation, it definitely, if there's arthritis in that knee, those could help. I mean, sometimes they help for a long time, sometimes they don't help at all, and so there are some products out there that we can reach for. The traditional supplements are glucosamine chondroitin based products. There is a newer supplement, Flexidin Advance, that contains UC2. It's a different mode of action than what the glucosamine and chondroitin would be. So it's something to look into, maybe to ask your veterinarian about that. But again, see your veterinarian with that problem, because it does sound maybe more like it's more than just the luxating patella, and those can wax and wane for years or forever. They don't just get over that, as you may know. Looks like your dog also has Cushing's. Cushing's somewhat of a difficult problem to manage. I think the first thing that needs to be done is to figure out, is it due to an adrenal issue or due to a pituitary issue. So your veterinarian can certainly run some diagnostics to figure that out. There are some treatments for that, but depending on the cause of that, that's what you need to figure out. It was a long-winded answer.
Yeah, no, that sounds great. All right, so now we have a question from Sarah, and she wants to know that, her question is, when her dog wakes up, she jumps around on 3 legs and kind of holds her hind leg up for a while, and then within a few minutes she's back to normal. Is it possible her leg is falling asleep? She's a young, healthy, active rescue dog, or should she be concerned and go to the vet?
Yeah, no, great question. I mean, it just depends. I mean, I don't know how old this dog is, so maybe there is some arthritis going on when that dog lays down. Sometimes with arthritis in joints, they can be slower to get up. With this, dogs certainly, I guess their legs can fall asleep. It has to do with the nerves there, but it almost sounds like if we're 3-legged lame, meaning that one leg is just kind of toe touching on that leg or holds it up. Similar to the previous question, possibly could be a patellar luxation. Again, those are typically more common in smaller breed dogs than larger breed dogs, and I don't know what breed of dog this is, but would make me think that maybe that patella kind of luxates as that dog gets up, and then it goes back into place or gets back into where that dog will use it again. So kind of a recurring theme with that. Veterinarian can figure out if there is a patellar luxation in that leg. If there is some arthritis there's certainly supplements out there before we reach for prescription type products for pain. So I would have that leg looked at, but my best guess would probably be a patellar luxation. There is surgery for patellar luxation as well, so that's something to discuss with your veterinarian.
Great. Okay. Next question would be, my dog keeps scratching his fur constantly, and I notice it seems to be a bit dry and irritated. Is there any thing like a shampoo or something you would recommend to help him out?
No. Depending on the time of the year, where you live, dry skin definitely can be something that occurs in dogs and cats. It can be difficult to manage, even more difficult for your dog or cat. So it's something that we have to really look at the causes. Is it just dry skin? Is it the environment? Do we live in a dry area? Is it the nutrition? Is there allergies going on? So there's a lot of things that we can look at to figure out the cause. If it's just very mild, there's certain products, topical products, an aloe and oatmeal shampoo certainly that would help with that, to help moisturize that skin, help kind of repair that skin barrier or layer. And something that you could do at home. It's over-the-counter type product, but it's certainly something that could help out. If it doesn't take care of it and it's not doing a good job with that, then certainly having your veterinarian see that dog or cat for the dry skin, because there may be some bigger underlying issue than just a dry skin from the environment or something that we can control.
So thanks for the questions. These are great. Keep them coming. This next one here is from Doreen. And Doreen has a 5-year-old Dachshund Bichon mix that limps on his front paw. He's been taken to the vet. The vet prescribed some...
An NSAID. Yeah, it looks like.
Yeah.
A non-steroidal anti-inflammatory.
And they're not a huge fan of it. The limping stops as quick as it starts. And she's wondering if her dog is just jealous and pretending to have an injury for attention.
Yeah. Dogs typically, we think they may do that. I don't know that they typically have that capacity. We'd like to think that they do, but they probably don't have that capacity to act out in a way like that, or have some other, if we think they're jealous, to limp on that leg. I could be proven wrong about that. There could be something there that maybe there is a little bit of a soft tissue injury, and with some movement, it does go away. With any type of arthritis or joint issue, we don't just recommend that they lay there all the time or they don't do any movement. We recommend that they do have some physical movement or rehabilitation essentially. So it may just be that this Dachshund Bichon is just kind of working out of that as you get to the veterinarian, unfortunately. So other thing to consider with that is again, there are some joint supplements that may be safer to try than jumping right to an NSAID that typically has some side effects if given long term. And so joint supplements such as like Flexidin Advanced with UC2, again, that works in a different way than glucosamine and chondroitin as far as a mode of action. It's actually working on the immune system to decrease the inflammation or the reaction of the immune system to the arthritis. Great question.
Yeah, that was a good one. Okay, so this next question just came in from Eileen. So, hey Eileen, thanks for following us. Her question is, I was told that my dog has cancer. How do I know when he's in pain? So first of all, I'm sorry to hear that.
Mm-hmm. Yeah, no, very sorry to hear. It's every dog and for that matter, cat is going to be a little bit different. I guess cats are probably going to be a lot different in that regard. But it's really hard to determine that. And in practice, I would always tell owners, your pet. When their behaviors change, what's normal for them. You're with them all the time. But, with cancer, it is difficult because a lot of times you can't see the cancer. All you can really rely on is what your pet is doing. So I would say if they're more lethargic, they're not as active as they once were, not getting up, really more severe pain since you can't see that. Typically the cancer, if we're talking about something that's internal, they may not be eating, they may not be drinking, If you offer them a treat, they may not take that treat. Sometimes pain can resonate as excessive panting as well. Just not willing to get up and move because they are painful. So those are some of the things that you can look for when a pet has cancer or cancer internally or that you can't see.
So just to kind of recap that real quick,
Yeah.
signs of pain or discomfort in your dog or cat would be anything where they're kind of like hiding from you, they're not eating, they're obviously slow to move, and they're not interested in just kind of their usual activities.
Yeah, and again, the panting can be some of that as well. You can see some panting with that for sure. Yeah.
So thank you, Eileen. That was a great question. This one is from Heather. She would like to know if pain can be seasonal, like something that changes with the weather.
Thanks, Heather, for putting this question in. Pain can sometimes be seasonal. I mean, I think we like to think that it's with. Did you about knock over the camera? Maybe.
She did,
We lost it. We're back now. So, always fun with these live things for sure. Sometimes we think that pain can be seasonal. I think more if they're just lying around, we may think that it's a seasonal thing. If they're trying to stay warm, they're laying in one spot and then they get up. When it's cold out and they limp more, it may be because they're lying on the ground. They're lying in one spot for an extended period of time. There may be some thought to that it is seasonal, but I think it probably has more maybe to do with the temperature and just laying there for extended periods of time. So thanks.
Okay. Erica has a question about her cat. Sometimes my cat meows consistently and I can't figure out why. He has plenty of food and water and a clean litter box. Is there an underlying issue or does he just want attention?
So cat just meows constantly. So I'd want to know if the cat is just a few things, male or female, spayed or neutered, would be kind of my first questions there. It really depends on what is going on in the environment. Does the cat go outside? Does the cat not go outside? Is the cat, seeing something outside that they're interested in or trying to get to? I mean, there's a lot of things that can be going on there. I don't think it's your husbandry. It sounds like has plenty of food and water. Litter box is clean. There's nothing that you would be doing that's wrong. There's certain cats that maybe are somewhat more. Cats tend to be somewhat nocturnal and hunters, so maybe there's that need to do that. Not that you need to be letting your cat out, but it could be a sign of anxiety or stress. Again, not that you're doing something wrong, because a lot of times we aren't in their brains, so we don't know what's going on in there. So it may be something to consider. What time of day does this happen? Is it during the day or is it at night? If it's at night, there's certainly products out there, Zilkene, that's not necessarily has to do with cognitive issues, but it has been shown to help humans sleep, and we have seen that in dogs and cats as well, and I have seen it work on cats that have been somewhat nocturnal and that are vocal throughout the night. So something that probably visit your veterinarian and maybe talk about a behavioral issue, but certainly have a physical exam performed first to make sure there's no medical issues going on.
Great. Okay. So we have a question here from Diane about her 15-year-old Chihuahua. So she's an aging pup. She's got glaucoma, luxating patellas, arthritis, curvature of the spine, and pancreatitis. And she's obviously in pain. So she wants to know, how else you can help her. She, whimpers and cries.
It looks like she's also on some human pain medication that's extrapolated to the veterinary world. A lot of things going on there, Diane. I'm sorry to hear about that with the glaucoma, luxating patella, and arthritis. Pancreatitis as well, and sounds like maybe some arthritis in the spine. Certainly the tramadol that you're giving her, there's some variable thoughts on that as to whether or not that is truly going to help just by itself. There have been some studies looking at it, combining it with a non-steroidal anti-inflammatory. I would say if your pet is a candidate for that, sounds like maybe they've had blood work before. If the blood work is appropriate for adding in a non-steroidal anti-inflammatory, it may be helpful. Sometimes pancreatitis, it may not be okay to give that with that. Certainly a joint supplement is not going to hurt depending on the cause of the pancreatitis. I would consider asking your veterinarian for joint supplements to help out, but anything maybe if an NSAID could be added in, I would take that up with your veterinarian, a non-steroidal anti-inflammatory for your pet. So.
The next question is from Lorelei. She has 2 Australian Shepherds, and they are both showing signs of hip pain. Is there an over-the-counter med I can give them other than aspirin? And would you suggest that?
Yeah, great question. My daughter's best friend is named Lorelei, so I don't see that name very often, but thanks for sending in your question, Lorelei. The 2 Australian Shepherds with hip pain, certainly there's definitely better over-the-counter medications than aspirin, and if we need to jump to something that's more that's stronger, or something that is a true anti-inflammatory. Again, I talked about the non-steroidal anti-inflammatories, vetprofen being one of them, which is a carprofen, but your veterinarian can prescribe that for you. On the other hand, if it's early in the disease process, depending on what the hip pain is caused from, certainly joint supplements that are on the market. I spoke of Flexidin Advanced before with UC2. The nice thing about that product is it could be one product for both of your dogs, and it's one chew a day no matter the size of the dog, so you wouldn't have to get 2 different sizes depending on the size of your Australian Shepherds. I would assume that they're probably similar in size, but it's a kind of a one-size-fits-all type product. So encourage you to ask for your veterinarian about that product. You can certainly find information on our website about that product, and see if that's a right fit for your pet. You could also go to myhappypets.com to read more information about that as well.
This question is from Ashley. My cat used to love snuggling next to me and letting me hold her, but now she meows and runs whenever I try to show her this type of affection. Could there be an underlying issue that's causing this behavior?
Yeah, I mean, good question. Cats, there could have been something that happened that caused her to do that. I mean, where she was a little bit more open to you doing that. If something scared her while you were petting her, and more of like a traumatic type event, that certainly can happen with patients, and it's more of a behavioral type issue. If a traumatic event happens, they're going to they probably are going to avoid that situation again. Could there be some pain there? Depends on the age. I don't know that there was an age there, so not an age. So maybe if it's an older cats that are older, the percentage of osteoarthritis is really underestimated. About 90% of cats over the age of 12 have osteoarthritis, and which is a very high percentage, but cats tend to hide that. So if we are petting them and we're irritating them in a certain way by petting a certain area, typically probably their back in a pet or in a cat is very common to have some arthritis in the back. We should be aware of that, but it would have to, again, have your veterinarian take a look at her and see if there's any issues going on there.
Great. This next question is from Robin. She has a 13-year-old Havanese that has been excessively licking and biting one of his front paws. He was recently diagnosed with osteoarthritis, and she's wondering if this is potentially because of that.
Well, they depend on where the. No, good question, Robin. Depend on where the osteoarthritis was diagnosed. I mean, certainly if it is in that paw, I would say yes, it is probably from that osteoarthritis. Depending on if it was farther up the leg or not even associated with that leg, then I wouldn't think it would be associated with that. Is there osteoarthritis in that paw? If they didn't radiograph that, then I'd maybe have your veterinarian take a look at that paw, maybe palpate that paw or feel it to make sure that there's no pain associated with that paw. I wouldn't necessarily encourage you to do that, because I wouldn't want your cat to maybe turn around and bite if we do get some pain on that area. So if this is a different thing from what was diagnosed elsewhere, then I would have that paw specifically examined.
Okay. These have all been great. Keep your questions coming. We have about 10 minutes left, so thank you all so much for listening in. This is a question about a dog. So my dog used to love to go for long walks together, and now I can tell he's just not as agile as he used to be. What would you recommend to help with his immune and joint health?
So, as dogs age, they may not be able to perform as well as they did when they were a younger age. Oddly enough, that injuries are definitely more common cause of osteoarthritis in dogs than just old age. But as they age, they're certainly more prone to osteoarthritis or primary osteoarthritis. So we may need to tone down some of the exercise. Not that I don't would tell you to stop exercising, but maybe we can't go on as long of a walk or do the same type of terrain that you normally have done. And certainly, I mean, as we age, as I've aged myself, there's certain things that I don't do that I used to do. Used to be able to do flips on trampolines. Can't do that anymore, or at least I don't want to do that because I feel like I'll hurt myself. So my daughter wants me to do that, but I try to coach her on that. But it's so certainly we may have to adjust our routine of how long we go on walks, what types of exercises we do. The terrain that we're on, we may not be able to do big mountain hikes or things like that. But if they have slowed down, certain supplements for joints or osteoarthritis are out there. Flexin and Advance being one of them, as I mentioned before, with UC2 can be one that you could easily start, and minimal to no side effects, and again, once a day. There's also other glucosamine chondroitin type products out there, Flexidin Plus being one of those products that you could try to preemptively put your dog on. And then if that doesn't help, or you're seeing the problems worsen, which hopefully they wouldn't, then definitely consult with your veterinarian.
Okay. So we kind of have the same question, or a similar question, but for cats. I have a cat that used to run and jump all over the place, but I noticed recently that she hasn't been jumping up onto furniture or to any of her favorite cozy spots. Is there something I should be concerned with? Is there something I can do to help her get back to her normal self?
Yeah, anytime that you notice a change in your cat's behavior, it's certainly concerning. There could be other reasons, whether it's behavioral reasons, but osteoarthritis could be a possibility, or arthritis in the joint. Typically, it's more common in the back of a cat, and as I mentioned before, cats over 12 years of age, about 90% of them have osteoarthritis, and typically the majority of them, it's in their back. So that could be a cause of them not wanting to jump, not wanting to get in their favorite spots. Something that I would be concerned with, again, there are some joint supplements you can start out there early on, but if it's, I would certainly have your cat examined by your veterinarian to make sure that there's another issue going on, or more serious issue going on, or we can address an underlying issue. But Flexidin Plus, which is a glucosamine chondroitin product for small dogs and cats, is a product that you could preemptively start them on and get some good results. And if you don't see improvement, certainly we could have your pet or cat examined by a veterinarian.
So we have another question from Eileen.
Mm-hmm.
It's not really related to pain, but her question is, I have a question about dandruff. What do you recommend to help get rid of it?
Yeah, where I see dandruff, typically the most common thing, or most common species would be cats, older cats that tend not to groom themselves as well, and whether that's just they're tired of doing that, they're old, they don't want to do it, it hurts to groom, it hurts to turn their head a certain way or their neck a certain way, they tend not to groom, so their coat gets fairly rough, and along with that comes the dandruff. Certainly dogs can do that as well. A couple things that I would recommend, certainly, make sure they're on a quality senior diet. If it is an older patient or just a quality
10-year-old lab pit.
Yeah. Okay.
Yeah.
So quality senior diet. And then make sure you're brushing them quite frequently and grooming them yourself. So having a nice routine of care for brushing. And then certainly with the shampoos that are out there, there's plenty of shampoos, just over-the-counter routine type shampoos. I mentioned one earlier, aloe and oatmeal. There is an aloe and oatmeal type conditioner that will help with that somewhat dry skin, and I assume it's probably some dry skin going on there. And depending what area of the U.S. that you live in, we could have more dry skin than others. So those shampoos tend to help moisturize that skin a little bit more, kind of refreshing that top layer of skin and hopefully get rid of that dandruff. If it's something that gets severe or you're seeing red spots or any other type, what we'd say pustules, but almost pimples on their skin, then that's certainly a concern to take them into the veterinarian, or if that doesn't resolve over time.
I think we just have time for a few more questions. My dog is recovering from surgery, and I was wondering if you could help recommend any oral treatment to help him cope with the pain.
Yeah. What was it? Was it hip surgery or
yes.
what? Okay, so hip surgery. So hip surgery is a major surgery, whether it's a dog, cat, or human. So I say good luck on the road to recovery, and glad that that is certainly over with. Typically after those surgeries, dogs are on multiple medications for that pain. It is a fairly post-operative painful type procedure, so typically an NSAID would be given, or a non-steroidal anti-inflammatory would be given to those patients. If you're having that surgery, there probably was blood work done prior to that to make sure that the kidneys, the liver, most of the body systems are functioning correctly. So that's something that's important with non-steroidal anti-inflammatories, is to do blood work prior to putting a patient on a non-steroidal, specifically dogs. Typically, some of those out there, carprofen is a fairly common one. Vetprofen is a brand name of that product that they would be put on. Definitely, if your dog is painful on those products or still painful, we could certainly add in other products, but consult with your veterinarian on that. The other options, certainly a lot of veterinarians will put them on joint supplements concurrently. Joint supplements, on the other hand, don't necessarily deal with the pain right away, but over time can help with the building blocks of those joints, help with the cartilage in the joints. Specifically, again, UC2 can help out overall with the body's immune system reacting to the arthritis or the inflammation in the joint, and kind of tone that down. So that's another thing to add in. But NSAIDs are kind of the mainstay for post-operative pain. When it comes to orthopedic procedures, there's certain other medications that have been mentioned previously that they could add in to help out if we're overly painful with those things. So.
Okay. Well, I think that is actually about all we have today. Thank you all so much for listening in and for watching us and for asking questions. If you think that your dog or your cat might be in pain, I would take a note, of kind of the symptoms and things that you're seeing, and make an appointment with your vet. I know sometimes cats have a harder time getting to the vet, so maybe call your vet first and kind of get some information from them, just so you can do what you can to make sure your pet is comfortable. Anything else you want to add?
No, I just thank everybody for watching today. Great questions. If you have more questions, certainly write in. Isn't the only time you can ask questions. We can certainly respond to those. So if you have questions, definitely write in. And until next time, thank you very much.
Thank you so much.